Hi friends, I am Dr. Teena C. Bannihatti, obstetrician and gynecologist. Today I am going to explain you about NT scan. When is the scan done, how is it done, and why this scan is done, and what all information we are going to get in this scan. So NT scan is called as nuchal translucency scan. It is the very important third month scan of the pregnancy. It is done from 11 to 13 weeks of pregnancy. So how is it done? It is done through the abdominal route. So only if any findings has to be confirmed or if there is any doubt, then only transvaginal scans are done. Otherwise, transabdominally NT scan is done. There is no need to drink water or wait till the bladder fills. All those things are not necessary. So why is the scan done and what all information we are going to get from the scan? So as the name indicates, in NT scan we are going to see NT, that is nuchal translucency. So what is this nuchal translucency? So this is basically a small amount of water collection behind the neck of the baby. We call that as nuchal translucency. Its measurement is very important. In case if the NT measurement is high, there could be possibility of the chromosomal abnormalities like Down syndrome. So not only NT, we look for other important finding, that is the presence of the nasal bone, that is bone in the nose of the baby, whether it has formed or not. So what we saw in the early pregnancy scan, the baby was just like a dot or like a line or like a plate like. The baby has become like a mini human by third month, by 12 weeks. So baby has got head, neck, body, two small hands, legs, all the structures have been developed. So we look for the intactness of all the bones in the head of the baby, NT and the nasal bone, and the backbone of the baby, whether it is intact or there are any gaps in the backbone, and the early development of heart of the baby and the kidney development, and how are the movements of the baby will be able to visualize in the scan. Of course, we will see the heartbeat of the baby. So if you take the scan pictures of the NT scan, you will be able to see a baby and the heartbeat trace. Unlike the early pregnancy scan, NT scan is time consuming. Why? Because baby should be in a particular position for the scan doctor to take all the images and to take the NT measurement. So apart from this, we will see the cervical length. So what is cervix? It is the mouth of the uterus. We call it as cervix. So we'll be able to see the length of the cervix. So finally, we'll see the blood flow to the growing baby, whether it is adequate or not. So these are all the components of NT scan. So once your NT scan gets completed, on the same day, one of the mother's blood test will be there. We call that as double marker. So regarding double marker, you can find the details in my other video. Thank you.